The President.
Questions. Question number 1, the Honorable Tommy CHEUNG. President, some members of the catering industry have relayed that the pace of recovery of the business has been slow after the epidemic, and Chinese cuisine in local restaurants has lost much of its luster as fresh poultry cannot be used as an ingredient. They are of the view that as the risk posed by avian flu to Hong Kong has been relatively reduced, the government must increase the choices of fresh food ingredients available in the market to enhance the competitiveness of Hong Kong as a culinary capital. In this connection, will the government inform this council, 1, whether it will consider allowing local farms to keep poultry such as ducks, geese, and pigeons on an appropriate scale so as to resume the supply of such live poultry? 2, given that Hong Kong has ceased importing certain types of live poultry from the mainland for a number of years, whether the government will consider discussing with the relevant departments in the mainland so that the supply of an appropriate amount of live poultry such as ducks, geese, and pigeons to Hong Kong will be allowed, and 3, whether it will consider supplying live poultry to restaurants under specific control measures so that traditional dishes prepared with the use of live poultry can continue to be promoted and preserved, if not, of the reasons for that. Secretary for Environment and Ecology. President, upon consulting the Health Bureau, my consolidated reply to the question is as follows. According to the World Health Organization, WHO, the mortality rate of human cases infected with avian influenza H5N1 over the past 20 years has exceeded 50%. WHO experts believe that the current avian flu epidemic poses a continuing risk to humans. For Hong Kong, since the first local human case of avian flu was detected in 1997, Hong Kong has experienced 7 outbreaks of poultry infected with avian flu A of H5 or H7 subtypes. Human infection of avian flu was detected in the 1997 outbreak, in which 18 developed the disease, of whom 6 died. Between 2004 and October 2023, the Center for Health Protection of the Department of Health recorded a total of 29 cases, including 5 deaths of humans infected with avian flu. Epidemiological investigations reflected the source of risk for avian flu infection in humans in Hong Kong is from contact with infected live poultry or its environment. To safeguard public health, the government has implemented a series of measures at various levels of the live poultry supply chain to reduce the risk of avian flu outbreaks. So far, the risk of avian flu in Hong Kong is under control. With regard to Mr. Tommy CHEUNG's question, first, chickens in all local farms in Hong Kong are currently required to receive mandatory vaccination against H5 and H7 avian flu, and the government has been updating suitable vaccines to ensure sufficient protection for chickens on farms. Ducks and geese, which are waterfowl, are natural reservoirs of avian flu viruses. Previous studies show that live ducks can persistently shed virus even after being vaccinated against avian flu. Hence, vaccination is not entirely reliable for the prevention of avian flu in waterfowl. Moreover, while chickens may display significant symptoms or even die after being infected with the virus, waterfowl can be asymptomatic and can shed virus for a long time after infection. Since waterfowl mainly shed virus through the fecal route after being infected, the organic matters inside the fecal samples can affect the results of the rapid test, leading to false negative results. Furthermore, different from chickens, which can be reared under a controlled environment, the rearing of waterfowl generally requires a period of free ranging. Thus, the transmission risk of avian flu from infected waterfowl to other poultry and humans is much higher than that of chickens. International experts on avian flu have also pointed out that waterfowl could serve as a host for different strains of avian flu viruses to mix If waterfowl are simultaneously infected with different strains of avian flu viruses, the viruses can undergo genetic reassortment within their bodies, leading to mutation of the viruses. If the avian flu viruses undergo genetic mutations, it may reduce the effectiveness of the current mandatory vaccination program, thus increasing the risk of outbreaks in local chicken farms and posing a threat to human health. In view of the above considerations, the government has no plan to allow waterfowl rearing at local farms at present. Regarding rearing of pigeons, pigeons are not waterfowl. In response to the avian flu epidemic at that time, the industry requested for the surrendering of livestock keeping licenses to reduce the risk of outbreaks in Hong Kong. The government put in place various voluntary surrender or buyout schemes from 2005 to 2008 for livestock farmers who choose to cease operation voluntarily. Poultry farmers who chose to return their livestock keeping licenses received ex gratia payment. At that time, all pigeon farms in Hong Kong voluntarily returned their licenses and ceased operation for good. Following implementation of these schemes, to reduce the risk of avian flu transmission, the government has ceased issuing new livestock keeping licenses for keeping poultry, including pigeons. Second, to prevent the transmission of avian flu viruses from waterfowl to chickens, the government has adopted a policy of segregating of chickens from waterfowl at all levels from input to retail since 1998. We have legislation enacted to mandate that live waterfowl must be processed by central slaughtering and prohibit the sale of live waterfowl at retail outlets. Since 2004, because of the situation, livestock and geese have not been imported from the mainland to Hong Kong. Given the persistent risk of avian flu, we have no plans to raise the request with the mainland authorities for resuming exports of waterfowl to Hong Kong. As for live poultry, including live chickens and minor poultry such as pigeons, there is no ban in Hong Kong on live poultry imports from the mainland, and the government adopts an open mind. However, since early 2017, there's been no supply of live poultry to Hong Kong from the mainland. The Hong Kong SL government has maintained close communication with relevant mainland authorities regarding different issues of food supply, including live poultry from the mainland. We believe the mainland registered farms supplying live poultry to Hong Kong no longer supply to Hong Kong because of commercial considerations. 3. We understand that some local restaurants currently purchase local freshly slaughtered chicken from live poultry retailers for cooking. In order to provide more retail outlets for meeting public demand, we recently conducted risk assessment and consider that existing biosecurity measures can effectively control the risk of avian flu associated with live chickens. Therefore, on the basis that prevention of avian flu transmission will not be compromised, we plan to introduce an appropriate number of live chicken stores in new public markets or modernized markets that completely refurbish or redevelopment as far as circumstances allow. For instance, a new public market to be constructed in Area 67 of Cheung Kwan O will have 2 live poultry stores. The new live poultry stores will adopt designs of stringent hygiene standards and a display window for sale purposes. These stores will have dedicated slaughtering rooms inside, ensuring complete separation between purchasers and the live poultry. In addition, these stores will be equipped with independent air conditioning, ventilation, and air filtration systems to ensure good hygiene conditions. In summary, our current containment of avian flu in Hong Kong depends on the implementation of various preventive and control measures across different levels over the years, and this achievement does not come by easily. The government will continue to closely monitor outbreaks of avian flu in neighboring areas and continue to assess the transmission risk in Hong Kong and strictly implement various preventive and control measures and making adjustments appropriate to safeguard public health. Thank you, Mr. Tommy CHEUNG. Thank you, President. Secretary, you said that according to WHO, the mortality rate exceeded 50%. If you look at local cases, you can see that it was just scaremongering. But that aside, I'd like to refer to the second point of your reply, that we have not banned the import of live poultry into Hong Kong, but since 2017, we have not seen any supply of live poultry to Hong Kong from the mainland. As far as I can remember, very few we had very few live pigeons. Most of them were live chickens. You talked about that it was because of commercial considerations. Rather, I think it's because of your control measures. Since you maintain an open mind, Secretary, can you discuss with the Ministry of Commerce of the country, and how come we don't have live chickens and pigeons and geese from the mainland. Please do not say that there can be live poultry imported into Hong Kong. Secretary, I thank Mr. Tommy CHEUNG for raising this question so that I can understand the different treatments for live chickens and geese and ducks. I have a better understanding after some research. Now, in fact, we have maintained a liaison with the Ministry of Commerce, and we have checked with the authorities how come we don't have any live poultry from the mainland imported to Hong Kong. According to the authorities, they do not have any control of export of poultry to Hong Kong. So I believe it is really a commercial decision rather than any regulation on the two sides of the government of the country. So we have already written to the Ministry of Commerce to reflect public aspirations here. Hopefully there can be some live chickens imported into Hong Kong. So we're awaiting their reply. Mr. Shiu Ka-fai. Thank you, President. Last year, and around this time, we were all wearing face masks here today. Today is only Mr. Lee, who's suffering from flu, who is wearing a face mask. So you gave us a host of statistics about avian flu. Yes, we have to be cautious. The fact is, we don't have any case in Hong Kong, neither is there any in the mainland. We haven't got any live poultry or chickens imported into Hong Kong. Now, as we all know, the price-value ratio in Hong Kong is obvious to all. In Hong Kong, a live chicken costs $250, whereas it's only $70 in the mainland. I have met with the industry. We have told you time again that the government must take the lead in this consultation and negotiation. Otherwise, there won't be live chickens imported into Hong Kong from the mainland. So I put this to the Secretary once again. Will you yourself or your colleagues go on a delegation with members of the industry to discuss with the mainland authorities where exactly the problem lies? Secretary. Thank you, President. Here I have to say that we talk about the morbidity rate of the avian flu. Over 50% is a global figure. Of course, in Hong Kong, we have a preventive system, and our Center for Health Protection has its response. So we're able to lower the overall mortality rate to lower than the global average. But if you look at the number of cases in 1997, the mortality rate was as high as 33%. Even from 2004 to now, when we have put in place so many measures, the mortality rate is still close to 20%. It's a rather high figure. So avian flu is indeed a major issue for all health authorities in the world. We have done so much to control risk on a relative scale in Hong Kong, and so we should keep this level of public health safety as far as possible. As for the Ministry of Commerce, we have been discussing with them all along, relaying the concerns of the sector to the authorities. We are waiting for their response. I can undertake here that should I visit Beijing in the future, I am going to meet the Ministry of Commerce, and then I will relay your aspirations to the authorities to see whether there can be any change. Mr. Stephen Ho, which part of your question has not been answered? Whether your bureau and your team can go along to meet with the Ministry of Commerce with members of the industry. Well, when we have such a planned trip, we will discuss with the industry to see whether that is possible. Mr. Stephen Ho, the quality price ratio here is because we've only got 130 retail outlets. That is limited. So even if there is a live poultry from the mainland because we've only got 130 retail outlets, so they can only make so much profit. So it's lucky that in future there will be another 2 retail outlets, but all in all it's still just about around 130. As for why there is no live poultry imported from the mainland to Hong Kong, there are views that once there is an outbreak in Hong Kong, the mainland poultry farm may have to suspend operation for a few months because of strict regulation there, even though they can make a few more dollars per chicken here. Mr. Stefano, are you asking a question or giving us an answer? I have to give you the background before I can come to my question. So I am proposing to the administration. I disagree with their zero tolerance approach. You should not over rely on medical doctors to map out the risk assessment. Now, if you really have zero tolerance, say for traffic accidents, you should not allow people to drive at all. Can you consult veterinary experts to work out a control plan for you? Because if your medical doctors say that the risk should be zero, there is no way we can have live poultry. Secretary, you can see from our main reply that we're not saying that the risk of avian flu should be zero in Hong Kong. We have taken into account all scientific arguments and what technology can do at the moment. In Hong Kong, we allow the rearing of live chickens. And we are planning to provide more retail outlets for live chickens. We are tackling this problem with a scientific approach. We're not asking for zero risk. Mr. Stephen Ho asked whether we can consult veterinaries. Let me tell you that on waterfowl and also the different treatment between waterfowl and chickens, why the risks are different and the approach is different. This is based on views of our veterinary experts. So we give regard to the views of both medical doctors and veterinaries. Mr. Rock Shen, thank you, President. In his reply, the Secretary told us that it was all because of medical considerations that we don't have live poultry live waterfowl imported into Hong Kong. Is it really a constraint of manpower? If we have the right conditions in our slaughtering houses and in retail outlets and for testing, do we have enough manpower? Because if we have importation of live poultry or live waterfowl, do we have enough manpower to do the testing? Secretary, of course, we will ensure we have sufficient manpower to do the work. They may not all be civil servants. Where necessary, we can employ NCSE staff and even outsource workers to do the job. We're not worried about our manpower. Rather, we have to consider what measures have to be put in place for control and prevention of avian flu. And secondly, it is also for the mainland to decide whether live poultry should be supplied to Hong Kong. Mr. Tan Kapil, thank you, President. Now, people like to say that chicken must taste like chicken, and therefore, when we visit the mainland, we like to have chicken dishes. Or people may buy cooked chicken dishes back from the mainland to Hong Kong because the chickens there taste better. I don't know why the chickens in Hong Kong do not taste as good. They don't taste like chicken. So, in addition to keep for public health, I want the Secretary to ensure that we have better flavored chickens so that the chickens taste better in Hong Kong. Can you address the aspirations of colleagues here? Secretary, I believe different food ingredients will have different characteristics. I have checked with friends in the mainland. They feel that salty chickens in Hong Kong are also very tasty. So we talk about using different ingredients to prepare delicious dishes. Hong Kong is a culinary capital. We are renowned for that. So we should use different ways of cooking. We should provide good ingredients to create tasty dishes so that we live up to our reputation as culinary capital. Mr. Tommy CHEUNG, point of order. What is your point of order? Now, he was referring to a chilled chicken. Now, this is not the time for you to speak. So please be seated. Mr. Tommy CHEUNG. President, the Secretary gave us figures from WHO. And some members talked about zero risk. Now, if you look at the figures from 2003 to, or rather from in between 2004 and 2003, we've only seen 29 cases, including 5 deaths. Of course, one case of death is one too many, but it all boils down to the risk of, if we have only 1 out of a million risk, do we have to tackle the problem? If we are that strict, we can do nothing. So can you consult the country in between 2002 and 2023, or from 1997 to now? Can you ask the nation the number of avian outbreaks in chicken farms in the mainland or in places where there is a sale of live chickens? Do not just use WHO figures to scare us. You should obtain statistics from the country and from locally. You've asked your question, Secretary. President, of course, we will gather statistics from different places on avian flu outbreaks, and I'll see whether I can provide Mr. Tommy CHEUNG with such information for reference. But in between 2004 and 2023, we have got 29 cases, including 5 deaths. That is in spite of all the measures we have put in place. So we must not overlook the issue of avian flu. As I said, we will tackle this problem with in a scientific manner. Thank you.
Question 2, Mr. Vincent CHENG. Thank you, President. The Chief Executive announced in the latest policy address the establishment of a task force on tackling the issue of subdivided units to set the minimum standards of living conditions for subdivided units (SDUs) and suggest measures to eradicate substandard SDUs. The government subsequently indicated that in the course of formulating the eradication program, due consideration will be given to transitional and follow-up arrangements so as to avoid rendering the affected households homeless. In this connection, will the government inform this Council, 1, when eradicating substandard SDUs, how the government will rehouse the affected households and whether they will be provided with transitional housing or light public housing for seamless transition, if so, of the details. 2, as it is learned that since the implementation of legislation in relation to tenancy control and SDUs, the situation of the submission of notices of tenancy by landlords to the government has been unsatisfactory. Of the number of notices of tenancy received by the government since January last year, as well as the respective numbers of various types of SDUs reported therein, including room, cubicle, rooftop house, podium house, loft, bed space, space capsule, and other types of SDUs, and 3, whether a preliminary assessment has been conducted on the specific problem areas involved in substandard SDUs and of the expected implementation timetable for eradication. Secretary for Housing. President, the government has all along been paying attention to the housing needs of those who are inadequately housed. With the government's sustained effort in land and housing production, the continued increase in land and housing supply has presented us an opportunity to resolve this long-standing problem on subdivided units (SDUs). Following the announcement of the 2023 policy address, the government established the task force on tackling the issue of subdivided units, the task force, to conduct an in-depth study of the issue. The task force has just started its work and will need time to study in detail various aspects of the issue. It will take into account the views of different stakeholders and make recommendations to the Chief Executive in 10 months' time. After consulting the Rating and Valuation Department, RVD, my consolidated reply to the question raised by Mr. Vincent CHEUNG is as follows. The issue of SDUs involves the well-being of tens of thousands of families. Therefore, eradicating substandard SDUs is not a short-term target which can be achieved overnight, even if we arrange this. When formulating the relevant policies, the basic principle is not to render the affected households homeless. That's why we must give the whole issue careful and thorough consideration. During this process, the government will allow reasonable time for SDU landlords to carry out necessary rectification works for the SDUs to meet the relevant standards, as well as liaise with tenants on the move-out arrangement. Due consideration will also be given to the enforcement timeline and priorities for the eradication program of substandard SDUs, as well as follow-up arrangements. The government has identified sufficient land for providing about 410,000 public housing units in the coming 10-year period. With an adequate public housing supply, more housing options will be available for SDU tenants, and the government may then consider other solutions to eradicate substandard SDUs. Meanwhile, the task force will consider whether resources such as transitional housing or light public housing can be used to meet the short-term needs of SDU tenants. As for light public housing, the relevant works will commence soon. Pursuant to Part 4A of the Landlord and Tenant Consolidation Ordinance, a landlord must, within 60 days after the term of a regulated tenancy commences, submit a Notice of Tenancy, Form AR2, to the RVD to provide the particulars of the tenancy. As at the 14th of November 2023, the RVD has processed a total of 23,522 forms AR2, excluding forms AR2 with tenancies not meeting the definition of regulated tenancy and thus not required to be submitted to the Commissioner of Rating and Valuation. Most of the SDUs, 97.77%, are classified as room. The remainder, 2.3%, include cubicles, rooftop houses, podium houses, loft, bed spaces, and space capsules, etc. The RVD will continue to strengthen its enforcement and promotion to remind SDU landlords of the responsibility to submit Form AR2 with a view to collecting more Forms AR2. On the minimum standards of living environment of SDUs, the task force preliminary takes the view they should cover building safety, fire safety and hygiene requirements, living space, and so on. We take note of the discussions in the community on other standards such as SDU facilities and floor-to-ceiling height, and so on. The task force is open to different views and will study the issue in detail with a view to forging a consensus in the community on the task force's recommendations. The government will consider an array of factors when phasing out substandard SDUs. We should appreciate that SDUs serve certain social functions, so it's important that we get it right. As I mentioned just now, it is the government's target not to render a large number of SDU tenants homeless as a result of the eradication action. Therefore, when in the near, medium to long term, when most of our housing production target is met, then the government may consider more resolute measures to eradicate substandard SDUs. The issue of SDUs is highly complicated, but the government does not underestimate the challenge in resolving this issue. Still, the government is determined to take the first step in addressing this deep-seated problem. The task force will continue its in-depth study and engage views from various stakeholders to formulate feasible solutions which can tackle the SDU issue in an orderly manner. Thank you, President. Mr. Vincent CHENG. Secretary, I'm not sure if you're happy with the number of notices of tenancy received. I'm not happy with that. Now, there are 110,000 SDUs, so in 2 years' time we should have received 110,000 notices. But we've only received some 11,000 or so notices. That means there are another 80,000 SDU house landlords who are not respecting the law at all. Now, apart from reminding SDU landlords, what else are you going to do to step up enforcement? You need to show your determination in tackling the SDU issue, and then we'll have confidence that you're able to resolve the issue in the long run. Secretary, thank you. President, thank you, Mr. Cheng. Yes, 23,000 forms received so far. There's much room for improvement. At the same time, my colleagues are working very hard on various fronts. I can give you some more figures. Now, we have taken out 28 prosecutions, 26 cases are pending court hearing, and we are investigating 558 cases. We are seeking advice from the Department of Justice on 71 cases. Now, I'm giving you these figures just to let you see that this is an ongoing task. We need to identify the cases, we need to take enforcement action, and if there is need to impose a fine, we'll do so. So we will be stepping up our enforcement effort, and you'll be able to see the outcome of the relevant agency's work. Now, of course, there's something we can do further. Now, the RVD has now sent out some 140,000 letters. We try to inform SDU possible SDU tenants as far as possible about the new measure. And I would like to make an open appeal here. SDU tenants, you enjoy certain rights. If you have any doubt, there's a new document called AR4. It is a simple reporting form of the RVD. You just need to fill in some basic information, and then RVD could follow up on the case. And we also communicating with some estate agents, so they will remind both the landlords and tenants of their respective obligations and the price to pay when these obligations are not met. Now, there is a charter covering some 90 estate agencies. They have, and so that's encouraging too. So what we are going to do more in enforcement, that's for sure. Thank you. Mr. Standing. The government is to eradicate substandard SDUs. Now, how determined the government is depends on how much public housing supply it has. If the government does not announce the information, well, then people will still think the government is only paying lip service to the issue. Now, there are people who live in SDUs for 2 or 3 or even 4 years, and the housing condition is absolutely appalling. So can the government announce the number of public housing units you have, so you are able to phase out the substandard SDUs? If you do not announce the figure, then you are just helping SDU rents to go up, and you're also helping SDU conditions to get worse. Secretary. Thank you, President. Thank you, Mr. Ng. For future public housing supply of the government, well, that's actually publicized. We have 410,000 public housing units, including both rental housing units and subsidized flats. And our demand is 300-something thousand. These figures are all out in the open. As for transitional housing, we are working on that. Initially, the target was 20,000 units. So now we're able to provide an additional 1,000 units. So the total supply is 21,000 units. And there are 9,000 transitional housing units already commissioned. I went to an opening ceremony yesterday. And then in 2024, that's the supply peak. There will be another 14,000 units. There will be another 11,000 units available, and then for light public housing, we've signed the works contract already. There will be 17,000 units. For another 3,000 units will soon be coming to LegCo to seek funding, so that for the 30,000 light public housing units, works will commence soon. So all this information is again out in the public. And for when the housing supply, when there will be so much housing supply, and where all this information is also in public domain. And as the on the website of the Development Bureau, where land is available, and when again the information is all there. So we have given enough information to tell the public we have sufficient supply of public housing. As for short-term housing projects such as transitional housing and light public housing, we have an adequate supply. That's why we have the determination to resolve the SDU issue, because we have enough supply to back us up. Mr. Chan Hock Fong. Well, as Mr. Vincent Cheng pointed out, registration of Form AR2 is not satisfactory, but then you have now rolled out Forms AR3 and AR4, but you don't address the issue of AR2. There's no point really. Now, because people are not submitting AR2, so now you've come up with AR3 and AR4. So how many cases are you going to take action against? Do you have the figure? Secretary. Well, AR2 is actually the notice of tenancy under the relevant ordinance. This is information that the landlord must provide for us to keep record. And in the process, maybe tenants call the RVD to make inquiries, and then they find out, well, actually the landlord is not complying with certain requirements, and that's what RVD colleagues find out, and then we follow up. And then we have come up with AR4 because SD tenants are busy with their work. They just want to provide some basic information so we can follow up on the case. And we're not saying that they can only submit AR4, but AR4 is actually a simplified version of report form. And so tenants will know they can submit this form for us to follow up on the case. And all these forms are complementary. And in response to Mr. Vincent Cheng, I did say, yes, there is much room for improvement in terms of the submission of AR2. We will be doing more publicity and education. And on the part of landlords, we have in mind a target. The RVD will randomly select 1,000 landlords to submit information in 2024-25. They will be required to submit information so we can check whether they comply with our requirements. Thank you. Mr. Jeffrey Lam. Thank you, President. The government estimates that 30% of the SUs are substandard, and after the government completes its eradication exercise, we can expect that landlords will either renovate the SDUs and then increase the rent. And for existing SDU tenants, if they move out, probably they won't be able to move back into these SDUs with the same rental level. So maybe tenants move into transitional housing still, they're not allocated public rental housing, they have to go back to SDUs, and then the worst case scenario is they can't even afford to go back to live in SDU. So will the government keep housing them until they are allocated public rental housing? Secretary. Thank you, Mr. Lam. Well, your question exactly illustrates the reason why we have to handle very carefully the whole process, because when we handle SUs, that means certain substandard SUs will no longer be available, and we want to stop the resurgence of substandard SDUs too. And all that is related to the adequate supply of public rental housing, or for transition housing or light public housing to play a role. And so then we will see what the pace should be. Well, just like in the antechamber exchange session this morning, members asked whether we will set priorities. Maybe for a building the condition is poor, then there will be a higher priority. And then other members suggested that for SDU tenants with children, they may be given priority as well. So, as to how we set priorities, again, is closely related to the supply of public housing. We need to make sure that there's alignment between the two. yes, we are keen to resolve the SDU issue, but it doesn't mean we can resolve it overnight. So we can't rush. We may have to start with the worst SDUs and do it step by step. Which part of your question has not been answered? Sorry, speaker's not coming through. Secretary, do you have anything to add? Sorry, speaker's not coming through. Now, for conventional public housing, we're not counting transitional housing and light public housing, we have enough land to build 410,000 units, and the demand is 308,000 units. But then that means there is enough buffer. But then the units will only be available in the second 5-year period. So we will see a substantial increase in public housing supply in the second 5-year period, and we can see there is more than adequate supply of public housing. For most who need public rental housing units, they will be allocated one. At the same time, we have transitional housing and light public housing to serve as buffer. So we see the opportunity for us to improve housing condition. And with an increase in housing supply, to start with, substandard SDUs won't have a market anymore because there is an adequate supply of public housing. At the same time, we believe SDU rentals will come down. Dr. Wendy Hong, Secretary, for households living in the worst SDUs, a good percentage of them do not yet have Hong Kong identity cards. For example, they are non-refoulement claimants stranded in Hong Kong, and there are even illegal workers here. So they have poor financial means. That's why they can only afford the worst SDUs. They are not eligible for public rental housing. They are not eligible for light public housing. So if you are to eradicate substandard SDUs and improve the living condition, and if you allow them to move into transitional housing, even then, would you actually attract more such people to come here to Hong Kong? Now, illegal workers, they're not allowed. There is relevant legislation to deal with that. And then Dr. Wendy Hong just now mentioned the question of mainland children born in Hong Kong with mainland parents, and then there are others who are here in Hong Kong with housing needs for various reasons. Well, the task force will look into that and see which groups of these tenants are covered by the task force terms of reference. But if other policy bureau or departments are involved and there is need for them to provide information, yes, at the task force, we will invite these departments or bureau to discuss the issue together and see how we can resolve it. Ms. Doreen Kong. Well, if we want to resolve complicated issues, we have to first get the picture right. Now, it seems that with the forms AR2, you don't have accurate information. So hard work is not enough. We need to see result. Secretary, can you undertake to collect the most accurate information about SDUs in the shortest possible time? Secretary. Thank you, President. Thank you, Mr. Kong. Yes, it's right. If we want to resolve the SDU issue, we must first learn about the issue. That's why we need 10 months to do studies, and then we can try to collect useful information on SDUs. And then we could make recommendations to the Chief Executive on how to handle the issue. So this is information is very important, but we're not underestimating the challenge here, because maybe there are different SDUs are in different buildings, and we may not be able to access all these SDUs to check on the condition. We may have to ask certain groups to help us to collect useful information. As for different government departments, they may also have certain information, and we hope that these departments will also give us the useful information for our analysis, and we are making plans for that. Thank you.
Chun-sing.
Mr. Lam Chun-sing, question number 3. It has been reported that many public refuse collection points lack staff convenience facilities, including the absence of individual restrooms, changing rooms, toilets, and insufficient furniture, such as lockers, tables, and chairs. Some cleaning workers even have to scavenge for waste furniture and electrical appliances for use at RCPs. In addition, many village-type RCPs lack water and electricity facilities, as well as areas for short breaks and meals. In this connection, will the government inform this Council, 1, whether it will study the introduction of a scheme to improve various public RCPs and expedite the improvement, refurbishment, or reprovisioning of some permanent off-street public RCPs with poor staff convenience facilities? If so, the details and timetable, if not, the reasons for that. 2, in light of the Occupational Safety and Health Council's conversion of medium-sized modular houses into solar cooling kiosks for use by outdoor workers, whether the government will consider using this as a model for setting up mobile rest kiosks in rural and remote areas so as to provide frontline cleaning workers with a better resting environment, and whether 3, whether it will study the formulation of a building design code for staff convenience facilities at public RCPs, such as classifying RCPs according to their gross floor area and type, and requiring the authorities to provide corresponding staff convenience facilities based on such classifications. If so, of the details; if not, the reasons for that. Thank you, President. Secretary for Environment and Ecology. President, the cleaning workers, the frontline cleaning workers, whether they are civil servants or outsourced service contractors, the government attaches great importance to their welfare. So the Food and Environmental Hygiene Department has conducted a comprehensive review on the basic needs of frontline workers, including drinking water, places for short breaks, water for cleaning tools, and toilet facilities. Now, due to geographical constraints, some facilities may be located outside the workplace. Now, even though they may be located within 10-minute walk from the workplace, we've noted that some frontline workers choose to rest or eat inside the refuse collection points or in areas that are convenient. So, subject to objective conditions, the FEHD will further improve working conditions of workers and provide more convenient staff facilities through refurbishment or facelifting of our CPs. Now, my reply to the Honorable Lam Chun-sing is as follows. 1 and 2. At present, the FEHD provides approximately 170 off-street RCPs in urban areas. That means the refuse collection vehicles can enter for collecting refuse instead of having to handle it on roadside. It also provides 900 village-type RCPs in rural areas. Now, while there are cleaning workers stationed at off-street RCPs, there are none stationed at village-type RCPs. Instead, mobile cleaning teams are responsible for cleaning up refuse at village-type RCPs every day. So at present, we have provided facilities that can facilitate workers to rest temporarily, to have meals. They also have space for changing rooms, storage space, toilets, shower cubicles, microwave ovens, electric steamers, refrigerators, and so on. Among the 163 permitted off-street RCPs, we have various facilities provided in 147 RCPs. And 92 RCPs have changing facilities, 116 have storage facilities, 127 have refrigerators, 111 have food heating equipment, and 63 have resting space. There are only 16 RCPs due to geographical constraints that cannot have these facilities. Now, we foresee that by 2024 onwards, 11 newly built off-road RCPs will have air conditioning and individual resting rooms. The FEHD, in collaboration with the Architectural Services Department, has progressively conducted comprehensive refurbishment and facelifting work. For older RCPs, we will be providing resting rooms, relevant facilities as far as possible. And since 2020, refurbishment for 38 off-street RCPs have commenced, and 14 of them have been completed. And we expect that there will be another 11 RCPs that are expected to commence works in 2024. And now it may not be possible to provide all facilities owing to space constraints. The FEHD will resort to other means. Now, regarding village-type RCPs, they are typically smaller and have no attendants deployed there. Now, due to space constraints, staff facilities cannot be provided in those RCPs. The FEHD will arrange workers to use facilities at nearby off-street RCPs or other venues as far as possible. To further enhance the resting environment of cleaning workers in rural areas, in summer this year, we have put on trial solar cooling kiosks. These kiosks are equipped with solar energy, including air coolers, electric fans, exhaust fans, and the preliminary assessment has been satisfactory. And we also have plans to install 54 kiosks in 12 districts and provide similar solar-powered facilities in 15 resting rooms on or before April 2024. The FEHD will review the actual effectiveness of these solar cooling kiosks and collect feedback from frontline workers in order to optimize the design and operation of facilities to meet workers' needs. Now, FEHD will identify more suitable locations for providing facilities. Third, the accommodation regulations stipulate the standards for the design of all government buildings, including the provision of adequate staff facilities according to number of workers. For example, the building design standards stipulate that each worker is entitled to changing and storage space. Now, all newly built off-street RCPs are required to provide these facilities. Apart from building design, FEHD, together with relevant department, have reviewed the standard size of resting room in off-street RCPs. Under the new standards, the off-street RCPs will have at least 20 square meters of resting room. They will be equipped with tables, chairs, and relevant facilities, and they can accommodate 10 to 15 workers. So these standards have been incorporated in the FEHD's handbook on standard features for RCPs. Regarding village-type RCPs, FEHD will continue to provide resting facilities for workers at appropriate locations and will put up notices at all roll call points which clearly indicate the location of facilities such as drinking water dispensers, toilets areas, and they'll ensure that frontline workers will be aware of these facilities. Mr. Lam Chun-sing. Thank you, President. The Secretary's response is that there are a lot of facilities in RCPs, but they have to be provided according to the conditions. Now, if you look at this photograph, if we add a microwave for workers to reheat food, now that's feasible. They have sufficient space. And I'm not asking for all RCPs to install air conditioners, but you should at least have better space dividers to divide rest areas and the refuse. Now, a lot of RCPs right now, their facilities are of varying standards. They have to scavenge discarded material and reuse that. But in the 2019 budget, the government spent $600 million to renovate public toilets. So will you set aside some resources, not necessarily $600 million, but can you renew the standard facilities of RCPs and add necessary facilities and improve the resting area once and for all? Secretary. President, in my main response just now, I answered the FEHD will, given the appropriate conditions, we will undertake renovation to improve working conditions. So in this respect, FEHD does have a plan. We will improve conditions step by step. It's just that some RCP's location or size have constraints. So if you want individual resting area or storage area or eating area, so that might not be feasible. But in those conditions, the department will increase other facilities such as drinking water dispensers, refrigerators, a microwave, and so on. So there might be individual RCPs. The workers can provide feedback to the department. There might be room for adding a microwave, but the department was not able to provide that. So they can provide feedback and we can look into it. And we will improve it phase by phase. Thank you, President. Hon Cheng. The off-street RCPs, in their initial design, they just wanted refuse collection receptacle and have the vehicles come pick it up. They never considered workers' needs for resting, for having meals, and so on. Our frontline workers, they collect the refuse, but they themselves are not disposable. They're not expendable, so we have to attach importance to their work environment. Secretary, in your response, you said that 100 of these RCPs have no rest areas. And you can see workers have to collect scraps of paper, carton boxes. They have to have meals there, rest there. That is not ideal. And in addition, you mentioned even if there is renovation works, it does not solve the problem of them needing space to rest. So what effective measures do you have to remedy their rest and work requirements? Secretary, now as the legislator, the honorable legislator said, frontline workers provide essential services. We attach great importance to their work environment and their rest needs. I had said that in this term of government, I had requested FEHD to undertake a comprehensive review. We need to meet workers' minimum needs. They will have sufficient drinking water. They will have sufficient rest time. They will have toilet facilities. There will also be areas for them to rest and to have meals. So the legislator mentioned our initial design of RCPs was done years ago, and it did not accommodate their rest needs or storage needs. So under these circumstances, we asked FEHD to make arrangements for all frontline workers. They need to provide an area within 10 minutes walk from their workplace where they can rest and have meals. So we have ensured that these minimum requirements can be met. So as in my main response, we have taken note of these conditions. Some frontline workers, they might think it's more convenient. They might think a 10-minute walk is too much. So they might choose to rest inside the RCP or outside the RCP. And well, when conditions are available, we should try to accommodate them. So we do have two measures. One is the renovation works we mentioned before, so I won't repeat myself. Second, we note that in rural areas, their space is limited. We cannot provide resting area. So we've considered the solar-powered kiosk, cooling kiosk. And we are conducting a trial program in 3 areas. So not only can they rest, they have electric fans, they have different electric appliances, they can rest and have meals there. So in 12 districts next year, we will expand our trial. When we conduct the trial, we want to collect workers' feedback. So after collecting their feedback, in the future, if we feel it's satisfactory, we'll roll it out. We'll have a widespread rollout of this solar-powered kiosk scheme. Mr. Wong, Mr. Kingsley Wong, could you speak into the microphone? Our cleaning workers deserve our respect. The secretary said Hong Kong has 170 RCPs, but the renovations pace is only 12 per year. So it will take more than 10 years to complete renovation. But even after it's renovated, the working environment is not desirable. People don't want to rest there. On the mainland, in Shanghai, Guangzhou, they can work and rest under the bridges. So could the government consider setting up resting areas under bridges? Secretary, just now I mentioned in rural areas we will be using solar-powered kiosks, cooling kiosks. These are simple kiosks. So after this trial, if it's received favorably, we will consider in urban areas, for example, under the bridges, we can consider doing that. But we need to hear from workers' feedback after the trial, and we can see whether that kiosk is whether it is received favorably. So we need some trials first. We need to consider their feedback before we roll it out widespread. So if the RCP itself is not a favorable location, we can look at options outside the RCP. President, today's question is revolving around RCP workers in the response. The Secretary did not clarify he did not specify whether these conditions or these remedies would target outsourced workers or civil servants. Sometimes when you outsource workers, you segregate civil servants and outsourced workers. So when we also have scenarios where the refuse is relocated outside of the area and the area is used for storage. So will there be a time deadline for remedying these problems? President, in the main response, I made it clear that the government attaches importance to frontline workers' welfare. So whether they are civil servants or outsourced workers, we have therefore instructed FEHD to undertake a comprehensive review of frontline workers' needs, basic needs. So all frontline workers will be covered, not just civil servants. And additionally, aside from hardware improvements, we are currently requiring in our contracts that the contractors need to be aware of frontline workers' needs. For example, when they work outdoors in the sun, they have to be aware of work conditions. So it's specified in the contracts. FEHD also has a central investigation unit where they see whether there is compliance with the contractual obligations, whether the contractors are living up to contract specifications. For example, if insufficient drinking water is not provided, that is a serious penalty. There is a serious penalty. We can terminate the contract. So whether it's hardware or software, we will apply that to all our workers, whether they be civil servants or outsourced workers. So can we meet all our goals? Well, as I mentioned, there are geographic considerations, so you might not be able to meet all these requirements. So aside from hardware, we are also looking at the solar powered cooling kiosks to make up for when conditions are insufficient. Thank you, President.
Question for Honorable Nixie LAM. Thank you, President. Under the existing Sexual Conviction Record Check or the SCRC scheme, employers may request prospective employees or contract renewal employees who undertake work relating to children or mentally incapacitated persons to make an application for a check. There are views pointing out that the relevant arrangement can hardly provide adequate protection for disadvantaged persons. In this connection, will the government inform this Council, 1, as there are views that the coverage of the SCRC scheme is limited, whether the authorities will regularly review the coverage of the SCRC scheme and consider expanding the coverage concerned to include all tutors, coaches, and volunteers who undertake work relating to children and adolescents. If so, of the details, if not, the reasons for that. 2, as applications for the check should be submitted by applicants on a voluntary basis to the Hong Kong Police Force, whether the authorities will consider changing the nature of the SCRC scheme from voluntary to compulsory. If so, of the details, if not, the reasons for that. And 3, as details of an applicant's sexual conviction records won't be disclosed in the check result, whether the authorities will, by drawing reference from the experience of overseas countries, disclose details of an applicant's sexual conviction records or grade sexual offenses according to their gravity, and inform the applicant's existing or prospective employer of the grade of sexual offense committed by the applicant. If so, of the reasons, of the details, if not the reasons for that. Secretary for Security. President, the government has been actively implementing various measures to protect children and MIPs or mentally incapacitated persons from sexual abuse. Among them, the Hong Kong Police Force implemented the Sexual Conviction Record Check or the SCRC scheme in December 2011 to minimize the risks of such category of persons being sexually abused. The SCRC scheme, which is voluntary in nature, enables employers of organizations or enterprises that engage persons in undertaking child-related or MIP-related work to have an option to request eligible employees to apply to the police for sexual conviction record check in order to ascertain whether they have any sexual conviction records against a specified list of sexual offenses. While protecting children and MIPs is our top priority, the government must strike a balance among various considerations, including meeting the needs of employers, maintaining the smooth operation and sustainability of the SCR scheme when considering enhancement of the scheme. After consulting the police, my reply to the various parts of the question is as follows. 1. The scope of the SCRC scheme has been gradually expanded since its implementation. Currently, eligible applicants include prospective employees, contract renewal staff, as well as staff assigned by outsourced service providers to organizations or enterprises applying to organizations or enterprises. For instance, private interest associations or organizations such as women clubs, sports clubs, and music centers for work relating to children or MIPs. As at this October, the police have received a total of over 580,000 new applications and 120,000 renewal applications, and the auto telephone answering system has received more than 680,000 inquiries about the check results. In recent years, the numbers of new applications and renewal applications have seen an upward trend, reflecting that the existing scheme has been widely used and is effective in providing employers with useful information that help them make employment decisions. After a public consultation, the LRC Law Reform Commission published a report on sentencing and related matters in the review of sexual offences in 2022, which covers a review of the SCRC scheme. The LRC considers that the government should extend the scheme to its fullest to cover all existing employees, self-employed persons, and volunteers. The government agrees that the scope of the scheme should be expanded to further strengthen the protection of children and MIPs. However, there are a huge number of employees and volunteers in Hong Kong, and hundreds of thousands of them are believed to be engaged in child-related or MIP-related work. Therefore, in considering the expansion of the scope, we have to be prudent and ensure that there is sufficient capacity given the limited capability of the electronic system and constraints in the police's manpower and resources. At present, the SCRC system is capable of handling about 60,000 applications each year. According to the performance pledge, the check result will be uploaded onto the auto telephone answering platform within 5 working days after receiving an application. As the number of applications will substantially increase after expansion of the scheme, the police is making strenuous efforts in enhancing the SCRC electronic system and setting up an online application platform. We expect that starting from next September, the system will be able to process at least 210,000 new applications annually. While ensuring that there is sufficient capacity to process applications made under the SCRC scheme, we will expand the scope of the scheme in a gradual and a phased manner in the light of the recommendations of the LRC with a view to minimizing the risks of children and MIPs being sexually abused. 2. As to whether SCRC should be made mandatory for employers or employees, we agree with the LRC's recommendation that the most urgent task is to expand the scheme to its fullest and review the need to make it a mandatory scheme at an appropriate time later. Legislating for a mandatory sexual conviction record check has to be considered carefully as it involves the stipulation of penalties. From the perspective of practical needs of the society, mandatory checking may not be applicable to all situations. For instance, the risk of employees committing offenses of sexual abuse is relatively low if there are also other people monitoring their work. In such cases, employers may not need to request employees to conduct SCRC. Furthermore, we must strike a balance between the two major principles of protecting children and facilitating rehabilitation, and carefully assess the impacts of the introduction of mandatory measures on the society. The existing voluntary SCRC scheme has been operating smoothly and is well recognized by the society with its benefit of flexibility. Our priority now is to expedite the enhancement of the existing scheme. We won't consider changing the scheme from voluntary to mandatory for the time being, but we will keep in view its operation from time to time and review the need for legislation in the future. 3. Currently, the government doesn't disclose details of an applicant's sexual conviction record to his employer. However, if an applicant has committed sexual offenses, the police will give the applicant a written record with the crimes committed specified therein. The employer may obtain such record from the applicant if necessary. If the applicant refuses to provide it, the employer may refuse to employ the applicant to prevent him from undertaking work that involves contact with children or MIPs. Therefore, there are already channels in place for employers to obtain such information. It's not necessary for the police to take the initiative to disclose the details of the applicant's conviction to the employers or to grade the sexual offenses according to their degree of seriousness. This can strike an appropriate balance between protecting children and MIPs from sexual abuse and protecting privacy. The government will actively expedite the enhancement of the SCRC scheme to further strengthen the protection of children and MIPs. Thank you, President. Ms. Nixie LAM. Thank you, Secretary. Thank you, President. There are views that we should strike a balance between protecting children and facilitating rehabilitation of ex-offenders. From the perspective of parents, I think one case is one too many, especially a case involving sexual abuse of children. I don't think people who sexually abuse children should have the benefit from being kept anonymous from these records. Hong Kong is being very lenient. In some countries, they ask the relevant details of the sexual offenders to be disclosed to the community. I want to know if the government has plans to publicize the blacklist for parents so that parents don't need to be worried all the time. Secretary, on whether we should publicize the sexual conviction records details of a person, we have to take a prudent approach. If we randomly or freely disclose details of a sexual offender on the internet, that would deter or impede the rehabilitation of sexual offenders. Say, a young person may have committed sexual assault, and since then, should he be stigmatized? I think that's not in line with the values of our city. This SCRC scheme strikes to make a balance between protecting children and MIPs from sexual abuse and protecting privacy, as well as the rehabilitation needs of ex-offenders. I think we should not freely disclose details of offenders with sexual records. Ms. Elizabeth Kwok, President, sexual abuse has a long-lasting effect of children. I think the government, as well as all adults in Hong Kong, should do our best in protecting our children. We should not wait any longer. This SCRC scheme, when the proposal was tabled to the Legislative Council in 2011, I already proposed that the sexual conviction records of private tutors should be included in the scheme. Some teachers, they may switch to becoming volunteers or private tutors, and there are sexual assault cases involving private tutors. In 2022, there was one such case, and at that time, the judge mentioned that the SCRC scheme does not cover private tutors or volunteers, and that's a loophole. I want to know if the government has plans to plug the loophole. Also, is the electronic system capable of processing all the applications? We have waited for 12 years already. When can the government tell us that the electronic system has the capacity to include or cover sexual conviction records of private tutors and volunteers, and when will you make the scheme mandatory? Secretary, the scheme was rolled out in 2011, and we need time to review the use of the scheme. We need time to think about how we can enhance the scheme. In 2021, we thought there was a need to expand the scheme. Over the years, we have expanded the scheme to cover contract renewal, employees, as well as staff assigned by outsourced service providers. I agree that we should also cover self-employed persons, including private tutors and volunteers, as well as existing employees under the future scheme. However, there are hundreds and thousands of people that fall under the scope. Next September, we'll be able to enhance the capacity and process at least 210,000 new applications annually. We will, if needed, enhance the manpower required and enhance the system so that we can process 300,000 new applications annually or more. As mentioned, we believe that there are hundreds and thousands of volunteers in Hong Kong. We have to take a gradual approach. We should first cover self-employed persons such as private tutors and see how our handling capacity is. Then we will cover volunteers. We do have plans to do so. Our ultimate goal is to cover all existing employees, self-employed persons, as well as volunteers under the scheme. President, the Secretary did not mention about the timeline of when volunteers will be covered. As mentioned, next September, we'll be able to enhance the system to process 210,000 new applications annually. Afterwards, we'll think about how we can include more people under the scheme, and volunteers will be our first priority. We will allow organizations and enterprises to make applications to check the sexual conviction records of their existing employees. Private tutors will be covered under the scheme as well. Reverend Peter Kuhn. For indecent behavior, they are not covered under the list of offenses of the scheme. I want to know if the government will move with the times and renew the list of offenses covered by the scheme. Secretary, some of the offenses mentioned, such as voyeurism, is some of the new offenses, and we will, as appropriate, include these new offenses into the list of offenses covered by the scheme. Mr. Edmund Wong, since the implementation of the renewed scheme, employers can decide on their own whether they would like to check the conviction records of their employees. Earlier, the Education Bureau in 2017 issued guidelines that schools should check the sexual conviction records of their employees. If the scheme is expanded to, say, residential care homes or volunteers, well, as mentioned, there are hundreds of thousands of people working in these organizations or residential care homes. I want to know if employers are vigilant enough to make application or take the initiative to check the sexual conviction records. I'm glad that the LRC made the suggestion that there should be a renewed scheme. However, there isn't a timeline set by the government yet. My question for the Secretary is that I understand we need to take a balanced approach. We need to protect our children. At the same time, we need to protect personal privacy. Can the Secretary give a clearer timetable in this regard? Secretary, our goal is to expand the scope of the scheme to cover self-employed persons, volunteers, as well as existing employees. As mentioned, we believe there are hundreds and thousands of these people. However, we do not have a very scientific approach in estimating the exact number of these people. We hope that after we've expanded the scheme, we'll be able to cover all these types of persons mentioned. Then next step, we will think about whether we should make the scheme mandatory. There are different uncertainties, so it's not scientific if I tell you a definite answer now. I think that at this stage, we should not make it mandatory. This is because, if we look at the figures, most of the employers nowadays check the sexual conviction records of their employees. There are only a few cases in which employers do not check the records. For instance, the employer may already know the prospective employee. Also, the person may have already turned over a new leaf. In other situations, there are different people in the work environment, and the employees may not be working one-on-one with the children. We also want to give opportunities for young people to turn over a new leaf. So after taking all these into considerations, we think that we should only consider whether we should make it mandatory in the next step. Mr. Kenneth Leung. I agree that the government should expand this scheme. As mentioned by the Secretary, next September, the capacity of the system will be boosted to some 210,000 new applications annually. I wonder if the government can further simplify the procedure. Can we first look at whether the persons were involved in cases in which they were found guilty and not guilty? We should first look at whether the persons were found guilty or not guilty. Then we can think about how we can further enhance the system. Well, every year we're talking about 210,000 new applications to be processed. That means every day there will be a few hundred applications that need to be handled. I want to know if the Secretary has anything to say about this. Secretary, currently, if we discover that a person has no conviction records, within 5 working days, the relevant details will be uploaded to the system. If we find that the person has previous records or conviction records, then we'll invite the person to verify the relevant records. Then we will disseminate the relevant details to the relevant parties. That's what we've been doing now. Coming up next September, the system will be upgraded and we'll be able to process more applications. Currently, applicants will have to have their fingerprints taken in the police headquarters. In the future, the persons will not have to go to the police headquarters. They can go to 5 different police stations to have their fingerprints taken, and part of the procedures will be moved online as well. We'll decentralize the procedure to provide more convenience to our citizens, as well as boost our capacity of the system. If we think that it is probable to process more new applications, or if we think that there is a need to do so, we will enhance manpower. As to how much manpower we need, we'll have to look at the circumstances then. Ms. Judy Chen, the main report of the Secretary did not mention about spent conviction records. I see that LRC in last May in its report, they mentioned that they agree that there are sufficient justifications to cover spent conviction records, but they do not support the inclusion of spent conviction records under the SCRC scheme. Can the government tell us whether people with spent conviction records can take care of our children? Secretary, under the current scheme, according to the relevant ordinances, if the conviction records are spent, they will not be reflected in our system. We adopted this approach because we think that we need to strike a balance between protecting children and MIPs as well as protecting our rehabilitated offenders. As mentioned, say a young children or a young person may have sexually assaulted another person, but does that mean we are not giving chances to that person to turn over a new leaf? We have to take care of the rehabilitation needs of ex-offenders, and we have to also consider whether it is safe to review all the details of ex-offenders. Currently, we don't see that it will pose high risks to children and MIPs by not covering spent convictions. Also, to respond to Peter Reverend Kuhn's questions, the new offences mentioned are already covered in our current list.
Question 5, Professor Chan Wing-kwong.
Thank you, Mr. President. Regarding the funding of the University Grants Committee, or UGC, for the full-time bachelor's degree programs in Chinese medicine offered by the Hong Kong Baptist University, the Chinese University of Hong Kong, and the University of Hong Kong, will the government inform this council, 1, whether it knows the numbers of UGC-funded first-year intake places for the aforesaid programs in the 2019-2022 triennium and the 2022-25 triennium, the total amount of UGC recurring grants allocated to the aforesaid 3 universities for such programs since 2020, with a breakdown of the respective amounts of funding by portion of teaching, or so-called T portion, research, and professional activity. 2. Given that UGC, in allocating funding for the T portion, groups the relative cost weightings into 3 price groups, namely medicine and dentistry, engineering and laboratory-based studies, as well as others, by broad academic program category, and it is learned that Chinese medicine does not fall under medicine and dentistry or studies allied to medicine and health under engineering and laboratory-based studies, whether the government knows the reasons for that, and 3, whether it knows if UGC will categorize Chinese medicine under medicine and dentistry or studies allied to medicine and health, so that bachelor's degree programs in Chinese medicine can receive appropriate funding for the T portion. If UGC will, of the details, if not the reasons for that. Secretary for Education. Mr. President, the government and the University Grants Committee, or UGC, have been proactively nurturing talents for various sectors in Hong Kong and attach great importance to the manpower needs of Chinese medicine. Under the existing mechanism, education and healthcare are specific manpower planned disciplines, which now covers Chinese medicine. The number of student places offered by the 8 UGC-funded universities in the manpower planned disciplines are determined by the Chief Executive in Council every triennium, taking into account the recommendations of relevant bureaus, and the universities will admit the specified number of students during the 3-year period. If there is an increase in the demand for specific manpower planned programs, the relevant bureaus will seek additional resources within the government in accordance with the established procedures, which will then be dispersed to the universities in the form of a block grant through the UGC. On the premise that the student number targets have been met, the universities may flexibly deploy their resources to meet the needs of different disciplines. Professor Chan's question touches on different bureaus' portfolios. Having consulted the Health Bureau, I'd like to reply to his questions as follows. 1. During the planning exercise for the 2019-22 and 2022-25 triennial, the CE in Council approved the provision of 79 and 70 first-year, first-degree or FYFD intake places, respectively, for the Chinese medicine programs on the recommendation of the Bureau. The relevant programs are offered by the Hong Kong Baptist University, the Chinese University of Hong Kong, and the University of Hong Kong. The number of FYFD intake places provided by the above universities in the 2019-22 triennium were 30, 25, and 24 respectively, while the number of FYFD places to be provided in the 2022-25 triennium are 30, 20, and 20 respectively. As aforementioned, recurrent grants are disbursed to the universities by the government through the UGC in the form of a block grant. As such, we do not have the relevant figures on the portion of recurring grants allocated to the Faculty of Chinese Medicine or School of Chinese Medicine within the universities. 2 and 3. During the triennial planning exercise, the UGC assumes an advisory role in assessing the public funding requirements of the universities in accordance with the established formula. On such basis, the UGC recommends the amount of recurring grants to be allocated in the universities within the triennium for the government's consideration. Subject to the decision of the CE in Council, the UGC Secretariat will disburse the funding according to the government's decision. The methodology adopted by the UGC in determining the funding recommendations for the allocation of recurring grants to the UGC-funded universities is made public in the government's LegCo brief on recurrent funding for the UGC-funded universities universities for each triennium. Among others, the funding for the teaching portion is determined on the basis of student numbers, their study levels, namely subdegree, undergraduate, taught postgraduate, and research postgraduate programs, modes of study such as part-time or full-time, and disciplines of study, etc. Some subjects are more expensive than the others because they require special equipment, laboratory, or more staff time, which will be reflected in the determination of the proposed allocation for each university. In accordance with the above principle, the UGC currently places 17 academic program categories into 3 price groups, with price group A being medicine and dentistry, with a relatively cost weighting, or RCW, of 3.6. Price group B being engineering and laboratory-based studies, including Chinese medicine programs under studies allied to medicine and health disciplines, with an RCW of 1.4, and price group C being others, with an RCW of 1.0. For research postgraduate programs, the RCW values are 1.8, 1.4, and 1.0 respectively. The UGC will continue to make reference to different data, such as the average teaching expenditure per student, in reviewing and refining the mechanism from time to time. I must stress that the funding allocated by the government to the universities is in the form of block grants. The underlying philosophy is that the universities have to assume the primary responsibility for optimizing the use of limited public resources and to properly manage and balance the allocation of resources among different disciplines on their own. The relative cost weightings, or RCWs, adopted by the UGC is only one of the many basic parameters for devising funding recommendations. It is entirely different from the internal mechanisms of the universities for allocating resources to different disciplines. Hence, these two should not be packed casually. Under the principle of institutional autonomy, the government and the UGC will not intervene in the internal resource allocation by the universities, which have to be responsible for their own decisions. In fact, the number of student places for Chinese medicine undergraduate programs only accounts for 1 to 3% of the total number of student places allocated to the 3 universities. With the government's annual recurrent grants to the 3 universities amounting to more than $10 billion in total, we believe that the universities have sufficient room for ensuring the proper allocation of resources. Now, if there is a special need for additional resources for individual programs at which the universities have genuine difficulties in meeting such a need, the existing mechanism allows the universities to apply for extra formulaic adjustments. In the past, there were cases where disciplines in studies allied to medicine and health being supported by the bureaus in terms of policies and resources and provided with extra formulaic additional funding to subsidize the fees for clinical practice. Should there be any such request on the special needs of resources relating to the Chinese medicine programs, the UGC Secretariat will refer them to the relevant bureaus for consideration. Thank you. Professor Chen Wing-kwong, thank you, Mr. President, and thank you, Secretary, for your reply. I think the Secretary is dodging my question. It's a waste of time. She has no commitment in reviewing the problem and solving the problem. Instead, she's passing the buck to universities. I feel disappointed. For undergraduate students of Chinese medicine and Western medicine, they are required to take a 6-year study program. They also need to undertake take up studies such as clinical imaging, anatomy, etc., not to mention the 3-year internship. That means for Chinese medicine programs, we need special equipment such as laboratories. However, the government does not answer the question. Whereas for medicine dentistry, there is a relative cost weighting of 3.6. For Chinese medicine, it comes with an RCW of 1.4. The government is placing emphasis on Western medicine over Chinese medicine. How do you address this issue? Will there be extra funding for Chinese medicine programs in the future to make sure that universities can help groom talents in supporting the research and development and the high-quality development of the Chinese medicine industry. Secretary. Now, first of all, I don't agree with Professor Chan that I'm deflecting the question. In fact, I laid out very clearly figures relating to the questions you asked, and I also explained the formula. Let me say this once again. In terms of the mechanism or the formula, the figures form the basis of the UGC's recommendation. But there are other factors, such as the average teaching expenditure per student, which is a set of empirical objective data. The UGC makes reference to such data. And then the figure will be divided by the relative cost weightings. In the past 10 years, taking into account the 3-4-4 academic structure, we have come up with the actual expenditure, and that the RCW is 1.3 to 1.5. For the RCW of 1.4, this is formed on the basis of objective data. But like I said, for the relative cost weightings, we need to consult the relative disciplines, such as the actual class hours, the teacher's commitment, and the portion of time allocated to research, etc. Now, Professor Chen said that I have not shown any commitment. Now, in the process of discussing with universities, if the universities see genuine need in asking for additional resources, and extra formula adjustments can be made through RCW's application. And in the past, in certain disciplines, additional funding was set aside to subsidize fees for clinical practice. That is to say, if certain disciplines in the universities run into genuine financial hardship, we allow flexibility by using the RCW arrangement. They also need to take into account the actual expenditure for that discipline and the commitment on the university. As I said, under the block grant mechanism, there should be sufficient room for the universities to make provisions for the relevant programs. If they're short of resources, they can apply to the government for additional funding. The UGC also reviews the mechanism from time to time. Dr. David Lam. Well, I understand that the UGC approves funding for the universities on a block grant basis. However, for the average teaching expenditure per student, one important element is the number of student intake places for the first year. Now, when allocating resources to different disciplines and programs, universities will also refer to this important element. Now, there are 3 universities, namely the Baptist University, Chinese University of Hong Kong, and Hong Kong U, providing altogether 70 places of Chinese medicine per year. So I would say that relatively speaking, we are not providing we're providing too little resources for these places. Without sufficient funding, how do we make sure that these universities will be able to engage competent R&D personnel to take forward R&D development of Chinese medicine? You can't have a cake and eat it. So will the UGC consider increasing the number of places for Chinese medicine students for universities to be provided with more funding in light of more student places to help support the development of Chinese medicine and to help retain students in Hong Kong? Secretary. As to how we come by the student places for Chinese medicine, the UGC has this mechanism to collect information. in order to review the allocation of student places in the triennium, especially since Chinese medicine is a specific manpower plant discipline. The Health Bureau will need to make recommendations and make commitments for the resources. The manpower planning for the 2025-28 triennium will start next year. The Bureau will take into account the relevant parameters and work out the plan with the UGC-funded universities. The UGC will also make recommendations on the government to the government on allocation of resources and the number of students intake. There will be due regard to the latest development, the government's policy directions. Apart from phasing out disciplines and programs that are no longer required, that they will also make new provisions for other programs necessary. I declare my interest as an employee of the UGC. I'd like to follow up on part 2 of the reply. Now for the 3 RCWs, that's 3.6, 1.4, and 1.0, in my line of work, I know for sure that for subjects such as history, philosophy, etc., the resources are shared. But what about the different price groups with different RCWs, 3.6, 1.4, 1.0? Can we mix all these disciplines in the same pot? I think it'd be quite tricky. I understand from the reply that the universities may apply for extra formulaic adjustments if there is a genuine need for extra resources. For Chinese medicine, I think that this request has been made before the government also has given the green light for extra funding. Against this backdrop, perhaps we should review the 3 RCWs and where Chinese medicine should fall. Should Chinese medicine be given an RCW between 1.4 and 3.6? Secretary. Now, I referred to the relative cost weighting of 3.6, 1.4, and 3.0. The calculation is based on the average teaching expenditure per student and other longer-term factors. The UGC also keeps in view the situation. It's not a rigid index. I need to emphasize that the RCW is just one of the many factors for consideration by the UGC in making recommendation on resource allocation to the government. Now, you mentioned the substantial change to the arrangement. This may pose difficulties to universities. In September this year, the UGC reviewed the RCWs, and based on the outcome of this review, a number of programs will undergo adjustments, including math, computer, and then also the law. The RCWs for these disciplines will be adjusted. The UGC will consider the actual expenditure of universities and the relevant disciplines in making adjustments. Apart from the review being undertaken by the UGC, when universities put forward the triennium work plan to the UGC, these universities are also responsible for ensuring that the books are balanced. If there is a genuine need for additional resources in the next triennium plan, the universities should apply for additional funding to the UGC so that the UGC will consider these applications and with the CE Council's approval grant the additional funding. Mr. Benson Loke. The BPA supports the development of the Chinese medicine industry in Hong Kong. During the COVID pandemic, we see effective integration of Western and Chinese medicine. From the reply, I understand that universities are given block grants to balance the allocation of resources among different disciplines. Now, many young people are interested in Chinese medicine. The problem is we don't have sufficient places in Hong Kong. Many of them then go to the mainland for studies and then for developing their career in Chinese medicine. This is counterintuitive to our efforts in developing Chinese medicine. At the same time, we strive to nurture talents. At the moment, the Baptist University is the only university that offers an undergraduate program in Chinese medicine. The Chinese Medicine Hospital will be established soon, so we will experience a manpower shortage. Now, Mr. Look, please just raise your question. 218 students applied for the program. Only 28 have been accepted. Now, will funding be set aside by universities to make sure that more Chinese medicine related programs will be operated to expand our manpower base? Secretary, well, we closely monitor the situation. According to the figures in the past 5 years, for the approved intake places for Chinese for Chinese medicine in universities, as compared to the actual intake, we find places in surplus. But starting from last year, we found that these places were fully taken up. And I want to add to that, apart from the 3 universities offering Chinese medicine programs, graduates in 30 mainland universities can also apply to sit for an exam to get qualified as a Chinese medicine practitioner.
Last question seeking an oral reply, Mr. Robert Lee. Thank you, President. The financial regulatory authorities of the mainland Hong Kong and Macau announced on 28th of September this year further enhancements to the Cross-Boundary Wealth Management Connect pilot scheme in the Guangdong-Hong Kong-Macau Greater Bay Area. In this connection, will the government inform this council? One enhancement is to include eligible securities firms as participating institutions of the relevant eligibility requirements such as capital size and experience. 2. As the enhancements also include expanding the scope of eligible investment product, whether the authorities will consider including investment products such as stocks, exchange-traded funds, futures, precious metals, and derivatives. If not, of the reasons for that. And 3, given that as at May this year, a total of 24 Hong Kong banks had commenced cross-boundary wealth management connect services, while as at the end of April this year, the aggregate quota usages under the southbound scheme and northbound scheme of the WMC covering Hong Kong and Macau were only 640 million RMB and 260 million RMB respectively, and it is learned that currently only a limited scope of Hong Kong financial institutions may take part in the WMC. Whether the government has discussed with mainland regulators how to specifically expand the scope of Hong Kong financial institutions that may take part in the WMC and scale up WMC services of such institutions. If so, of the details, if not, the reasons for that. Secretary for the Financial Services and the Treasury. President, the Cross-Boundary Wealth Management Connect in the Guangdong-Hong Kong-Macau Greater Bay Area was formally launched in September 2021 for residents in Hong Kong, Macau, and 9 cities in Guangdong Province to carry out cross-boundary investment in eligible wealth management products offered by GBA banks. The cross-boundary WMC provides GBA residents with a formal, direct, and convenient channel for cross-boundary investment in diverse wealth management products. It is a milestone in the GBA's financial development and a vital measure that deepens and widens mutual access between the financial markets of the mainland and Hong Kong. For Hong Kong, the cross-boundary WMC brings new business opportunities for the local wealth management industry and benefits the entire financial industry value chain. It incentivizes international financial institutions to allocate resources to Hong Kong for product development, product distribution, asset management, and other businesses. It also promotes the cross-boundary flow and use of RMB and further cements Hong Kong's position as a global offshore RMB business hub. As an innovative financial cooperation measure in the GBA involving 3 different regulatory systems, the cross-boundary WMC has been implemented under a pilot approach in a gradual and incremental manner. Based on their respective existing regulatory regimes and practices, the relevant regulators in the 3 places are maintaining close collaboration and seeking flexibility for policy formulation and implementation. My consolidated reply to the question raised by Mr. Robert Lee is as follows. The cross-boundary WMC has seen steady development since its launch. On participating institutions, currently, Hong Kong banks in retail banking or private banking businesses and registered with the Securities and Futures Commission for relevant regulated activities can take part in the cross-boundary WMC. 24 eligible Hong Kong banks have commenced relevant businesses with their respective mainland partner banks. On funds, the statistics as at the end of October 2023 published by the People's Bank of China show 62,900 individual investors in the GBA took part in the cross-boundary WMC, including 44,600 from Hong Kong and Macau and 18,300 from the mainland, with a total of more than 35,000 cross-boundary fund remittances covering Hong Kong and Macau, amounting to over 8.65 billion RMB. The aggregate quota usage under the southbound scheme and the northbound scheme covering Hong Kong and Macau was over 2.33 billion RMB and 250 million RMB respectively. Since the resumption of normal travel between the mainland Hong Kong and Macau, the southbound business has seen significant growth. In the first 10 months of 2023, the number of new individual investors taking part in the cross-boundary WMC exceeded 6,400, up 70% over the same period last year. Cross-boundary fund remittances amounted to over 6.2 billion RMB, having increased more than 5-fold over the same period last year. On investment products, northbound eligible products include low to medium risk public securities investment funds and fixed income and public equity wealth management products issued by mainland wealth management companies, excluding cash management-based wealth management products. Southbound eligible products include deposit, bonds, and funds domiciled in Hong Kong and authorized by the SFC, which are rated as low to medium risk and non-complex by Hong Kong banks. As at the end of October 2023, mainland investment products held by Hong Kong and Macau investors under the cross-boundary WMC stood at around 227 million RMB, including wealth management products at around 152 million RMB and funds at around 75 million RMB. Investment products of Hong Kong and Macau held by mainland investors under the cross-boundary WMC stood at around 2.351 billion RMB, including funds at around 28 million RMB, bonds at around 6 million RMB, and deposits at around 2.317 billion RMB. The mainland regulators of the mainland Hong Kong and Macau jointly announced in late September this year that they would enhance the cross-boundary WMC along 5 directions, including refining the eligibility criteria of investors to support more GBA residents to take part in the scheme, extending the scope of participating institutions to include eligible securities, firms, and expanding the scope of eligible investment products, increasing the individual investor quota as appropriate, and further enhancing the promotion and sales arrangements. For extending the scope of participating institutions to include eligible securities firms, the SFC is considering the criteria for licensed corporations to take part in the pilot scheme, including their license requirements, capital size, experience, and transaction volume of selling investment products, internal systems and supervision arrangements, etc. We believe the enhancements will further enrich the investment options of GBA residents and promote mutual access of the financial markets of the 3 places, conducive to the industry's exploration of business opportunities in the GBA, further realizing the potential of the cross-boundary WMC while enhancing Hong Kong's position as an international asset management center. The relevant authorities of the three places are refining their implementation arrangements and operational guidance with a view to announcing relevant details and launching the measures as soon as practicable. Thank you, President. Mr. Robert Lee. On including eligible securities firms, I want to find out more. If these firms are eligible, when can they start their WMC business? I can see many things have to fall into place before this can start. But will there be some interim measures? Do we have a timetable, Secretary? 2 points. First, the eligibility requirements. In my main reply, I stated that eligibility needs to be something that involves the regulators of the three places. So we take a pilot approach in a gradual and incremental manner. So we're still working on the eligibility requirements for eligible investment. That is, securities firms will have to look at their capital size, their experience, internal systems, etc. So we're working on this area. That is the specific requirement. I thank Mr. Robert Lee for helping us talk to the industry. That helped us find out what the industry thinks about the requirements. Now, the timetable. We are working on the requirements. So when can we roll out the new requirements and then work with the industry and announce the requirements? I would like to see this implemented soon as well. Our regulators are working hard with the mainland regulators. They're working against the clock. We want to be able to report this matter to members soon. Mr. Martin Liao. President, Guangdong has the largest number of high net worth individuals in China, and that's huge investment potential. They take a huge interest in ESG products. A 2022 survey shows many people who take part in the cross-boundary WMC also take an interest in ESG investment. Would there be greater publicity for ESG products in WMC? And what will be done to help participants in the southbound scheme learn more about ESG investment? President, the member made a great point. From what we've seen over the past few years, ESG products are now part of the mainstream financial market offerings. And that's a key element that's in investors' minds. In the southbound scheme, people participate in the scheme. We will keep enhancing the scheme. One area we will enhance will be the product. The products open to the mainland investors. We talked to the industry. We found out that investors want a wide array of products, especially in fund products, especially in equity funds. And this is one area we are trying to enhance. We want to include most of those medium to high risk funds domiciled in Hong Kong and that are rated as non-complex, such as the GBA equity stocks. We have talked to the mainland regulators on the product. We first find out where we have an edge, what options we can offer for the mainland investors. There are the participants, the product. We will look at them as a whole, and we want to be able to report the matter to members as soon as possible. Mr. Chen Kim-po. The cross-boundary WMC has seen steady development over the past couple of years. Will the scheme be expanded to cover insurance products? Secretary. Thank you, President. As I indicated earlier, the cross-boundary WMC is a new measure. It involves 3 different regulatory systems. That's why we take a prudent approach. It's a pilot scheme in a gradual and incremental manner. We start out with the 9 mainland cities of the GBA. The 3 different regulatory systems have their respective practices. We work closely together. We want a system with flexibility in policy formulation and implementation. We will see how the scheme goes, how the market goes, and then what we can do to enhance the system as a next step. At this stage, as I said in the main reply and in my response to the supplementary questions, so I've already indicated the point about the products. Dr. Tan Yueheng. Thank you, President. Figures. More than 200 million RMB in northbound, and then southbound trading sees 2.3 billion or so RMB. The figures fall short of what we expected. Why is this the case? Is it because our investment advisors cannot reach out to their cross-boundary clients? Because we lack a mutual recognition of cross-boundary investment advisors. Can we have some sort of regulatory mutual recognition? And then we can have a larger scope of mutual recognition for the qualifications of investment advisors in the GBA. Thank you. First, the WMC has been running for a while. We assess the situation. We look for the pain points or where we have to do better. We realized that when the WMC started running, it was right in the middle of COVID. There were restrictions on cross-boundary travel. So not many people could travel across the boundary. Many investors took part in cross-boundary investment for the first time. It took them time to find out about the investment channels, learn about the products and the macro environment. So the Hong Kong Monetary Authority and the Securities and Futures Commission will work with the industry on investor education. We want to strengthen investors' confidence in the WMC and enhance their experience with the scheme. There are 5 directions of investment enhancement. One of them, as Dr. Tan was saying, has to do with sales arrangements. Publicity, sale, these are affected by COVID. And it's still a pilot scheme. Not many people know the scheme well. That's why one of the 5 directions of enhancement has to do with sale arrangements and promotion. We work with the industry. We're closely in touch with the industry, and we thank members for their feedback. The industry has given us comments on the sale arrangements and promotion. We're working on the details about the implementation and the operational guidance. We hope we can announce the details as soon as practicable. Mr. Chen Pui-leung. When disputes arise or a participating body votes in the cross-boundary WMC, Hong Kong offers some sort of compensation to investors. But when that happens in the mainland, are mainland investors protected? Secretary. I was explaining the design of the scheme and how the scheme works. The scheme involves 3 regulatory systems. So when a dispute or a complaint comes up, that will be addressed based on the local laws and regulatory systems. Say it's southbound trading. If it's a complaint about the product or the sale procedure, Hong Kong's regulators will come in. But if it involves remittances, then mainland bank rules apply. So we follow the existing regulatory systems and respective laws of the place involved. Dr. Johnny Ng. I want to ask about the product offerings. Now we have the medium to low risk items, bonds, funds, deposit. Will there be medium to high risk products to offer investors more options such as virtual assets? Secretary. Thank you, President. First, I want to discuss the current situation. Northbound scheme. It has low to medium risk funds such as currency funds, bond funds, equity funds, and also the fixed income product, equity-based product issued by public companies, but they do not cover the cash management-based product. Now, southbound scheme. It contains deposits, low to medium risk, non-complex product, equities, for example, and bonds and funds domiciled in Hong Kong and authorized by the SFC, mixed funds, equity funds, etc. Based on banks' latest information, the banks provide more than 100 investment funds, more than 300 bonds, and deposits in different currencies. We want to keep the risks manageable, and we take an incremental approach to provide GBA residents with more cross-boundary investment options. Product variety and risk level are what we are considering. There is immense wealth in the GBA. Mainland residents have needs when it comes to asset allocation. We hope that we can capture these opportunities as we announce the enhancements in the 5 directions to meet these needs. Mr. Ron Chen. The main reply says that in late September, Hong Kong, Macau, and mainland regulators announced enhancements. One of them is about a higher quota for individual investors. The main reply says that the investment is just $2 billion or so, involving 60,000 investors. I agree with raising the quota for individual investors. But how will the government arrive at the right quota for investors? We should take a dynamic and holistic view of the WMC. When you look at the quota, you also have to consider the product available and also the user experience through the sale arrangement, and also the information available to investors before the transaction. We have to look at the 5 directions as a whole to get a full picture of how we can have a quota that can meet investors' needs and the needs of regulators about keeping the risks manageable. It's a balancing act. We want to have this risk and also meet the investors' needs in the GBA.
Government bills. First reading. Wild Animals Protection Amendment Bill 2023.